Hi, this is Dr. Kevin Tomassini from Spinal Performance here at Core Collective, and today I'm going to be talking about one of the most common postural problems that I see on the clinic, and that's called lower cross syndrome. So remember that the spine from the side should have three curves, one forward here on the neck, opposite direction on the mid back, and forward again on the lower back. What happens in lower cross syndrome is that there's too much curve on the lower back and the pelvis tilts forward, and that will cause a lot of pressure on the facet joints of the spine that can cause injuries, pain, and degenerative changes. Now, we talk about upper cross syndrome, forehead posture in another video, and this is when the head goes forward. So the neck gets straight and the head goes forward like this. So this will cause a compensation on the lower back and it will cause lower cross syndrome. So like this. So your posture from the side should be the head on top of your shoulders, shoulders on top of the hip, and hip on top of the ankles. What happens here with upper cross syndrome is this is upper cross syndrome, forehead posture, and then this will cause a compensation like this on the lower back. So rounded belly here, too much curve here on the lower back. This is called a hyperlordosis or Soy Pack, and again that will put uneven pressure on the disc and pressure on your joints. This happens because you have poor alignment of the spine and poor balance of the muscles. So there's going to be weak glutes, weak core muscles, and then you're going to have tight psoas. The psoas is a muscle that goes from the lower back to the front of the hip, and tight lower back muscles. So I will teach you some stretches and exercise to do to correct this condition, reduce this condition, and prevent degenerative changes and injuries. We're going to start with the first stretch to reduce the lower cross syndrome, and this is going to be called the cat and cow. Really simple exercise to do. The main thing is to move the pelvis forward and back and move the whole spine in a pumping mechanism. That will bring fluid to the joints and it will stretch the muscles as well. It will give you a better mobility. So really simple to do. You're going to go over all your fours, 90-degree here, 90-degree here, and you're going to bring your spine up and your head down. Make sure that you're moving your pelvis. You're going to hold it for 1 second and then you go spine down and head up. See how my pelvis is moving. So this is the movement. And you're going to do that for at least 30 seconds, 3 times. That's the first one. Another exercise that is good to reduce the lower cross syndrome, the Soy Pack or the hyperlordosis of the spine, is just laying down flat like this and bringing your knees to your chest. Hold it for at least 30 seconds. Flattening out the spine that is all touching the bed or the mat or the floor, and then you stretch the leg like this. Hold that one for 15 seconds, then go to the other one 15 seconds, and do at least 3 repetitions of that stretch. Now remember that when you have lower cross syndrome, the buttocks are weak and the core is weak. So one of the best exercises that you can do to strengthen your core is planks. Planks are really simple to do. You can go like this, straight line with your body. Hold the position for at least 30 seconds. If you can work out a little bit more, 45 seconds to a minute. And the other one is arm and leg opposition, or they call this bird dog. Okay? So you're going to lift your leg and the opposite arm and hold in a straight line for at least 30 seconds to 45 seconds or a minute, and then go to the opposite and do at least 3 repetitions in each side. Okay, hold it 30, 45 or 1 minute. To strengthen the buttocks, one of the best exercises that you can do is bridge. You can do it with 2 legs or you can do it with 1 leg. So you're going to start to do it with 2 legs. So you're going to go flat on your back, lift your knees like this, and you're going to bring your pelvis to the seat like this. Make sure that the contraction is not just on your lower back or on your hamstrings, that you feel it on your buttocks. So squeeze your buttocks, okay, and go up. You're going to do 15 repetitions and 3 sets. You can do it like that, and when it's easier, then you're going to make it harder on yourself by doing just 1 leg. Going to lift one leg, and you're going to put your hands like this, and you're going to go up and down, up and down, up and down. Okay, so 3 sets of 15 repetitions in each side, and that will help to strengthen the buttocks as well.